I'd like to speak about lumbar rediculopathy as a diagnosis. Rediculopathy refers to symptomatology that is referred down the leg. Since we're talking about the lumbar region and the lumbar spine, most of the symptoms go into the legs or are referred into areas of the leg or foot. Patients can have a weakness or loss of some motor function, loss of reflexes, but typically the reason patients are referred and the reason that these disc herniations are discovered are for leg pain. A lot of the pain derives from pressure on structures such as the ligaments or the nerve roots. Patients may come to us in neurosurgery with a diagnosis or are told their diagnosis is sciatica. Where that term derives from is the sciatic nerve is a large nerve running down the leg, and the nerve roots, multiple nerve roots, contribute to its distribution and its function. The majority can undergo steroid injections, physical therapy, various manipulations in an attempt to resolve their leg pain. A smaller portion of the patients that present with sciatica or lumbar rediculopathy or leg pain who do not resolve with conservative treatment or have such a significant disc herniation that they have a structural problem within the spine, and those patients are definite surgical candidates who will do extraordinarily well once the spinal canal and the nerve roots, the structural issue is dealt with and put back into a more natural situation. Patients can do extraordinarily well with the new minimally invasive techniques. Typically, surgery can be done through a tube with an operating microscope with a minimal incision, which people recover from very rapidly and can go home the same evening or even the following morning. They also can require very minimal pain medication post-operatively. Minimally invasive spinal surgical techniques can also be applied to spinal instrumentation surgeries, image guidance systems that are based on similar technology to the GPS satellite systems, an addition of CAT scan intraoperatively, which we utilize quite frequently, if not almost on every case. Procedures that used to be very large open procedures now can be minimally invasive instrumented fusion type techniques. Modern surgery has evolved quite dramatically using the technological advances that we have available to us. Patients that are selected properly can benefit greatly from the different surgical techniques available. The major goal of surgery is to relieve patients' suffering and to relieve their pain completely.